Chair, Excellencies, ladies and gentlemen, thank you for the presentations. Thank you for the floor. With medical teams working across Yemen, we, Médecins Sans Frontières, witness on a daily basis how the conflict is taking its toll on the population. In the past 2 years, thousands have been killed, injured and maimed. MSF alone has treated more than 60,000 trauma cases, including war-wounded and other violence-related injuries. Millions are desperate, in need of humanitarian aid to survive. Today, the healthcare system in Yemen is on the verge of total collapse. Less than half of all health facilities are functional. The others are either damaged or have insufficient personnel, drugs and equipment. They lack basic utilities such as water and electricity to offer even the minimum care. Most civil servants, including nurses and doctors, haven't received their salaries in months. Hospitals have also repeatedly been hit by shelling, missiles, airstrikes and gunfire. This includes 4 MSF health facilities in attacks, in which 26 of our patients and staff have lost their lives. Access to life-saving medical care in Yemen is shrinking by the day as the conflict continues. Vulnerable are increasingly at risk, and the injured and sick are dying from avoidable deaths. In response, we have expanded our operations to reach a budget of $70 million. Today, we run health facilities in 11 governorates, deploying over 1,600 national and international staff. Our teams provide care in 12 hospitals and support further 18 health facilities throughout the country. Humanitarian aid must urgently be scaled up. The health sector is of utmost importance. Hospitals need medicines, equipment and staff. The payment of salaries to civil servants and medical personnel must urgently resume, or the healthcare system will collapse. International organizations and agencies must increase their presence in the field to better respond where the biggest needs are. It is possible to provide direct humanitarian aid in an effective way. Donors need to increase funding and prioritize life-saving interventions. They will need to show greater flexibility in funding conditions so that relief operations can be carried out in this challenging context. The United Nations has to effectively put in place the Level 3 declaration arrangements. It is essential that senior staff with experience in emergencies and insecure settings are deployed to ensure Aid agencies and NGOs receive practical support. But funding is not enough. Aid alone cannot alleviate the toll of this conflict. Donor countries must also commit to stepping up diplomatic efforts to minimize the deadly impact of the war on the children, women and men caught up in it. Finally, we call yet again on all warring parties to ensure the protection of civilians and health workers, to allow access to medical care for the sick and wounded. Thank you.